Welcome to the Providers Report, where we delve into the world of value-based healthcare. Our mission is to empower healthcare providers with the knowledge and tools they need to deliver exceptional patient care. Each episode, we explore best practices, innovative strategies, and real-world examples of how to achieve the highest standards in patient communication and outcomes. Join us as we transform the future of healthcare, one conversation at a time.
Hey BDP fam, we're going to talk today with Dr. Ethan Ruhland, who is wrapping up his ortho residency currently. He's going to be chatting with us about all things involving that medical residency, the good, the bad, and obviously the ugly. So how does the process even work? How do you decide what specialty you want to pursue? And what can you really expect throughout the whole process? We're going to be touching on all of this. This episode was actually extra fun for me because Ethan is the former college roommate of my husband. Lord knows the two of them have endless stories between them. I'm definitely thinking about having them both come on for a future episode. They played college football together at Michigan State, and they both pursued professions within the healthcare field. So definitely stay tuned for that because I'm pretty sure it's going to happen. Let us know what you think about today's episode. Give us a shout out on Instagram. Leave us a review on Apple Podcasts. And like always, thank you a bunch for all of your support. Hey, Better Doctor Project. We are here today with Dr. Ethan Ruhland, and we're going to be talking to him about everything involved with medical residency, what goes into the process before, during, and after. So Ethan, thank you so much for joining us tonight.
Thank you for having me.
Absolutely. I really want to know your background, what you were doing before residency, currently what you're doing, and some of your ideas and plans for when you're done with residency.
Absolutely. So I'm born and raised in Michigan. I've been in Michigan essentially my whole life, and really since leaving for undergrad, I have been in East Lansing. So I came up to Michigan State for undergrad actually, and played football with, obviously, as you know, your husband, John, Dr. John Dale. And we were roommates there. And then after undergrad, I basically knew the whole time that I wanted to go into medical school. And then as I got toward the end, decided whether I wanted to go the MD or DO route, which we can get into later if there's questions about what the differences are. And then was fortunate enough to be accepted into Michigan State's College of Osteopathic Medicine, where I stayed in East Lansing for my first 2 years, and then ended up actually staying in Lansing for the second 2 years of medical school, which is kind of our clerkships, or kind of basically in-person, in-hospital kind of learning. And then I matched into my residency at McLaren Greater Lansing, which is here in Lansing, Michigan, for orthopedic surgery. And I'm currently in my fourth year, actually coming to the end of my fourth year of 5. So July is the beginning of the new academic year. So I'll start my 5th year in July, and then actually currently in the process of applying for fellowships. So fellowships in orthopedic surgery are 1 year, multiple different subspecialties. I am wanting to subspecialize in hip and knee replacements and revisions. And so I'm actually waiting. The match day for that is on April 20th. So my rank list is in, which again, we can get more into the rank process later as well. So that will be, once I match there, basically following the completion of my 5th year this next year. So in August of 2022, I will begin a fellowship somewhere in the US for 1 year. And then after that, it's all up in the air. My wife and I are both from Michigan, and we'd be more than happy to come back here. But, we are excited to get out of Michigan for that year of fellowship. And if something kind of comes its way from a job standpoint in an area that we feel like we would enjoy, we'd certainly be open to that, but certainly would not mind coming back to the mitten for the long term.
That's why you should totally move to Florida, right? That's what I'm hearing. I don't know.
Exactly.
That's awesome. So you said you pretty much always knew you wanted to be a medical physician. I mean, was that something in high school you kind of decided, or even younger?
So there is actually a letter that I wrote to myself in 5th grade about how I was going to go to Harvard Medical School. I don't know how I knew about Harvard as a thing, but I wrote a letter to myself in 5th grade that I was going to go to Harvard Medical School and be a doctor.
Oh, I love it.
That's awesome.
My mom's a nurse,
Okay.
Mhm.
has been for, over 30 years. She works for an oral maxillofacial surgeon, so very different from, my field. But I just always loved science and math and the idea of, I think a lot of people in the healthcare field, the idea of helping people and helping to fix a problem. I'm very problem kind of solution oriented, which I think is why surgery spoke to me so much. There's a very finite difference that you're making. It's very tangible. And so when I was kind of deciding on what I wanted to do, I was really drawn to surgery very quickly. And then it was through different experiences, partially my own injuries as a football player that had required surgery from orthopedic surgeons that kind of gave me that initial glimpse at orthopedic surgery, and kind of things progressed from there.
That makes more sense. I was wondering why ortho.
Yeah, so actually, I think we all probably took those tests in middle school or high school about like what you should be, and I don't know why, it said this, but mine was like be a neurosurgeon, and I was like, sure, that sounds great.
Neurosurgeon at Harvard. Yeah, why not?
Sure. But yeah, so it was, I always loved anatomy, and in anatomy, I mean, you learn kind of the entire body, all the body systems, but always like, the musculoskeletal system always was very fascinating to me. And kind of when I had my own injuries, it just, I realized, oh, this is the thing that people do. Like they fix, sports injuries, they fix, people that fix broken bones. I realized that orthopedics was this kind of huge, very expansive, specialty of surgery. And it really is different from other surgical subspecialties in that it kind of is I don't know, you're like the construction worker, I mean, it's a lot of, I think the stereotypical is people think big hammers, a lot of brute force. And there are certain surgeries that take that, but there's also a lot of very minute, surgeries, very small tools. You think of like hand surgery, those are more classically orthopedic surgeons that are doing like the hand surgery on, small kind of vessel, small, wearing loops and things like that. Basically, which are glasses with magnifying glasses on them, just so that you can see those smaller structures to fix and treat those issues or different diseases. So that was, obviously I've learned a lot of that in residency, but it was that kind of start process as an undergrad of my own injuries that got my interest. And I was fortunate at Michigan State that our orthopedic surgeons for the team, I basically just was able to ask them and, shadow them during undergrad, and that was kind of, really my first interest or experience with being in surgery.
I think that's really neat because I feel like when you're younger, you kind of think about healthcare like, oh, this is so cool. I'm gonna like figure out the problem. You find all the issues, right? All the symptoms, you put them together. And when you figure out what all of them match up to, you provide the solution or the treatment, right? And unfortunately, I think when we all get deeper and deeper and deeper into healthcare, which you're like smack dab in the thick of right now, we realize it's not black and white and it's so gray. And there are so many different types of like treatment and everything else, right? So it's not at all black and white, but it sounds like ortho is not black and white either. Of course, there's a beautiful art to it, I think, as well, even though you are sort of taking that hammer and nail, right? But it's neat because it is a little bit more straightforward, it sounds like, and that there's something really, really appealing about that. I know it always amazes me when I see like x-rays and MRIs of and CTs of patients post surgery. It amazes me what the body can handle. I'm like, hey, it looks like someone went to Home Depot and like, fixed you up. And they're like, yeah, I have no pain anymore. It's great. I just always find the body so amazing, even when it does exactly what it's supposed to do and what I expect it to do. I just think it's fascinating and that never gets old.
No, it really is. I mean, I show you my family now of like, oh, we did this, surgery, and we're looking at, showing them like a picture of an x-ray, obviously again, very, no, all patient information removed, but of something of a surgery we did. And it's like, it looks like an erector set, I mean, like you think of like spine, like a spine surgery, where we're like, you're doing like a spine fusion, and it truly is, it's screws and it's rods. And it's like, that's an erector set. Like that's what you played with when you were in, as a kid, and so it's a pretty amazing thing to be a part of, but it does sometimes it seems very not elementary. That's not to like undersell it, but like it just seems like, oh, this, like, that makes sense. It seems very straightforward.
Yeah.
One of my friends is a Gen Surg resident right now. I think she's wrapping up this year, and she explained surgery to me in a way that I will never forget. But she's just very like nonchalant and fun. And I was talking to her about like what she gets to do every single day. And she's like, yeah, honestly, it's just like playing a really, really intricate video game. And I was like, I'm sorry, what? She's like, yeah, I just show up. I put my arms through the sleeves and it's like a little tiny video game in there. And I looked at her and I was like, oh, wow. Like, this is why I can't be a surgeon, because like my brain cannot transform in that kind of way. And that's why I think specialties are so intriguing to me, which matches well with what kind of personality and mind. And so my biggest question for you, just because I don't know, when you're a medical student, so in those first 4 years, are there things that the school provides to you to kind of help you figure out what you might be good at or what you might want for those who just truly don't know? Because I have heard of some students who are kind of open to everything, or they're like, I like peds, but I like ortho, but I also like, gynecology. Like, there are some people who really don't know.
Yeah. So I'll speak to kind of my medical school experience. So truly from the first day at MSU being on campus, there's, maybe not dozens, but 10, 20 plus kind of small interest groups. And they're typically either one specialty or multiple specialties, or, for the whole, much like an undergrad, there's interest groups, or there's things, from a medical perspective, but also, like at Michigan State, one of the biggest groups is the community integrated medicine, where the focus is kind of providing, healthcare to our underserved communities. For myself, like there was an orthopedic surgery, as well as physical medicine and rehabilitation, which is a separate kind of almost like the non-surgical counterpart, if you'd say, in medicine to orthopedic surgery. It's very, it's a lot of rehab based. But it's very, musculoskeletal. I don't want to undersell it, because actually my best friend is a PM&R, physical medicine rehabilitation. We called PM&R for short. Is a PM&R resident, and it's amazing what they do. That a lot of if you think of like someone who's had a surgery or injury and needs long-term rehab, that's more so PM&R, or like people with spinal cord or traumatic brain injuries. Again, it's that long-term inpatient rehab. That would be a PM&R physician, would be kind of like the oversight, or part of that, kind of a primary part of that healthcare team to kind of, create the journey of rehabilitation for those patients.
That's actually where they put chiropractors normally when we're working in hospitals, is in that department.
Is in the long-term or subacute rehab, or very cool. That's awesome. Yeah. I don't know if I would have to ask them and see if they have chiropractors in at Sparrow. I know that like as a DO, like we learn a lot of the hands-on, which is where kind of a DO is almost like it's like an MD and a chiropractor combined, because we learn a lot of the hands-on medicine that our MD counterparts don't learn. And so, but basically in medical school, right from the beginning, there's a lot of different interest groups that you could look at and join, and a lot of them were run by, there was always like an attending faculty advisor who was that in that specialty to kind of provide their input and their experiences. And there were different opportunities to, again, like shadow in that field, or do different community outreaches that kind of focused along that lines. And so there was certainly exposure during the first 2 years, where those first years of medical school, much like I think, was it the first 2 years or year and a half of chiropractic school, was all bookwork. We had a lot of, certainly the hands-on learning of, how to interact with patients in clinic, and, the kind of providing those basics of patient care, or being a good and certainly an appropriate provider. And then it's in those second 2 years where we kind of have the hands-on in hospital. So there's an initial approach or experience to things in those first 2 years. And then it's in the second 2 years where the second 2 years of medical school are split into month-long rotations of different specialties. So like at my hospital, or really there's a set curriculum during our third year where I spent a couple of months doing family medicine, a couple of months doing internal medicine, a month doing OB-GYN, a month doing general surgery. There was, I'm trying to think of a month doing emergency medicine.
And everybody anesthesia. Has to, right?
Everybody has to. So every school is going to be a little bit different, but for the most part, especially during that third year of medical school, there's going to be a set curriculum that's going to at least expose you to kind of the basics. Again, when you think of like your friend who's like a general surgeon, out of general surgery come many subspecialties. Just like out of orthopedic surgery come many subspecialties, and even really most surgical specialties have subspecialization. But during medical school, they at least want you to get an exposure to like that general surgery, to say, hey, is this something that you want to do or look into further? And then, so it's really the unfortunate thing, I guess, if there's anything I could say, is that, to try and get some more exposure earlier, because it really is at the end of your third year of medical school, which this may have been a later question, but the end of your third year of medical school is when you really kind of have to have an idea of what you want to be.
Okay.
Because it's during your fourth year, most of the time you do some traveling to other to actually specific programs in the specialty that you want to pursue, almost as like an audition rotation. So you spend a month, 2 weeks to a month there with their program, with their residents, kind of getting to know them. They get to know you, and it's really an interview for both sides. And it's something I would say for anyone who's going, any medical student, is that anytime you're going to check out somewhere, whether it's a job or whether it's from like a residency standpoint, if you're going to go spend time somewhere, you're interviewing them as much as they are you. And so you go and spend time with the program, and then you have interviews during the fall, and then, end of the fall, early in the next year. And then it's actually in March. So we just this past month, we had our match for this next year's class of residents. So that
I love match day.
So those students, it's
exciting.
It's awesome. It's
so
the best.
Fun.
Hopefully my match day in a couple of weeks is just as fun.
It will be.
But yeah, so like we find out in March, who our residents are going to be, and they're still finishing their medical school, those last few rotations.
Awesome.
And then they'll start in July. So
very cool.
Yeah.
I love it. So, I mean, obviously everyone knows residency is very different from medical school. I know with some of the docs I used to work with when I was in a hospital setting, it was something that was kind of joked about a lot. Like, you think medical school is intense and crazy, and then you hit residency and it's this whole different world. So I would really like you to kind of explain that transition, and, were there any similarities? What were the major differences that you noticed? You're obviously in your, about to be in your last year. So I think you have definitely been exposed to the differences by now.
Yeah. So I will say this, and it is in no way meant to deter anyone from coming into the medical field, but I always used to say that after playing college football, I thought that medical school was as mentally difficult as college football was physically.
Wow.
And then residency is like a combination of the two. It's both physically and mentally very, it's very taxing. It's, amazing work that you're learning, but it is a constant, you're constantly learning, you're constantly moving. Every specialty, again, is different. But, some special, like everyone, when you start residency, your intern year is, again, pretty set, where you're rotating through different specialties before you focus on your specialty. So like my intern year, again, much like the third year of medical school, I spent a month in family medicine in those primary care setting, primary kind of field, internal medicine, ICU, things like that. And then the last, these last 3 years, and then the fourth year will be all, those were all orthopedic surgery. So the differences between the two is, again, it's the responsibility, I mean, truly as a resident, you are you're a physician. I mean, you're responsible for your patients. You have an attending who's overseeing you, but you're putting in orders. You're part of that healthcare team truly, and there's responsibility that comes with that, which is awesome. But it's certainly a steep learning curve when you first start. You have all this knowledge that you learned in medical school, and know so much about so many different diseases, and then you get into residency, and it's like, all right, now start using it.
Yeah,
treat your patients.
It's so different when you have to actually go from what's in your head to physically carrying that out, like on a patient. No matter how much you practice, I feel like that's like why we started BDP in the first place, is because there's this gap there about, and all the things that we don't talk about. You can, try to learn how to talk to a patient. You can imagine what you would say to a patient in any given scenario, but until you actually do it, or you remember a story someone told you about how they handled it, it just feels totally different. And I have patients tell me all the time, they always ask, like, oh, wow, I just realized your job is really physical too. A lot of the time they don't think about that aspect of it. They just think about like the mental part of being a doctor. And I'm like, yeah, you know what? It is physical, it is mental, it is social, and it's emotional. And all of those things, like, I think are what makes you so invested in what we do every day. It also makes you totally exhausted. Like, I know my first year in practice, I was dead at the end of every day. I was totally fulfilled, but also totally dead. And I think it's because it really taps into all those parts of being a human, which I think is really a beautiful thing too, but it can be super tiring and super intense, obviously, especially during residency where people are also watching you and quizzing you, and you have support from both sides, and testing, I think, from people above and below you, right? So it's really, really interesting. How would you suggest anyone, obviously they can prepare for that by doing as much schoolwork as they can, listening to things like BDP. How do you prepare someone, one, for the intensity, and two, to be resilient in the face of all those ups and downs?
Yeah, I think it's just, again, finding something that you're really passionate about. I think as much as there are things that we could make it better, I think that there's lots of opportunity to find something that you're most passionate about in medicine. And again, whatever healthcare field you go into, but know, it's something to remind yourself that you are making a difference, that it's something that you love. And I say, I mean, medical school or the healthcare field is not for everyone, and that's, again, not to discourage anyone, but it is a taxing job to take on, and it's important that it's really what you want to do. It's not worth. I have friends who started in a more intense residency and left and went to a relatively less intense field, and they're happier because of it. But it's one of those things where it's not worth being miserable, because if you're miserable, your patients are going to be miserable. No one's going to benefit from that relationship. And so, but I think it's something where none of us are alone in this journey of medicine, even when we feel like we are. And I certainly, personally, there are times where you feel alone, but it's important to remember that you're never alone in it. There's always someone who's going through likely a very similar situation, or has gone through that similarly. My friends from medical school, who are still my best friends, we had a lot of hard conversations about when we were exhausted or when things didn't make sense. So really making sure that you're tapping into people around you. And again, I think it's as much as social media sometimes I think can be a lot these days. I think it's amazing because it connects people across the world. Again, even from people you've had on your podcast that are going through or have similar but also slightly different perspectives that, again, make it better and can make your journey better, and say, right, hey, I was really struggling with this, but what you just said makes a lot of sense, and I can use that and tap into that to make kind of my experience with healthcare better. So I think that's one of the biggest things, is just find something you're truly passionate about, and it's okay to re-examine it over and over again. Is this really still what I want to do? Is this what I want, who I want to be? And then just don't be afraid to ask for help or lean on the people around you, whether that's your classmates if you're still in school, your co-residents if you're in residency, your practice, your partners in practice. From your guys' standpoint, like, never be afraid to reach out if you're struggling, because I'm sure that someone is either going through that or has gone through that before and can give you their perspective.
That's such great advice. It
Yeah,
really encompasses everything.
having support is everything. And I think you hit the nail on the head that the stress and the craziness doesn't end when you're done with school. Even
No,
it's not all sunshine and rainbows in practice either. I mean,
no.
we're really sharing how great healthcare is, aren't we? No, but it is important to realize that once you're truly done with school, we have things we're going to go through down the road. Healthcare is, like I always say, it is the most demanding but most rewarding profession to be a part of. And I think that that's huge. We go to work every day with such a great purpose. We help people every single day. And I always joke that like 98% of my job is incredible. But boy,
Hmm.
that 2% can kind of wear on you. And so to have a good support system and to have a positive attitude can really take you really far. So thank you so much for that advice. I hope our listeners really take that to heart tonight.
So I think something that, and again, I don't know, I hope that every medical school has this, but we had a wonderful, wonderful woman, Dr. Guro. She was a PhD psychologist who was, I'm trying to remember her actual, like what her title was at the medical school, but essentially she was there for support. She was there for, if you needed someone to talk to, and was there for, she was there for wellness, and she was involved in a lot of things, but in medical school orientation, she has a speech that she talks about, which I think, again, hopefully every school has, of like, that it's going to be important to take care of yourself while you're studying. And something she said that really, I don't think resonated with me until later on, when it came to fruition, was if there's anything unresolved when you enter into this field, it will come out. Like, it will be brought out.
Wow.
So like if there's any stressors in your life that you are left, that you're kind of like pushing down, like this will like bring them out. And I like didn't think of that, and she said it more eloquently than that. But I mean, essentially, like for myself, I was very, again, medical school, coming up as an athlete, everything was very regimented. I went to practice, I worked out, we had tutors, we had study hall. Again, everything was very set. I was fortunate as a student that like I certainly studied, but like I never had to I was able to be successful in school without like having to have like a strict regimen, all the time. And medical school forced that. I never did it perfectly, but I remember I got through the first half of medical, or the first half of my first year of medical school. And I like just started having, I was like, man, like, why aren't I feeling right? Like something like, I'm doing great in school. Like I'm, fit, I'm being active. And I ended up, needing, and just had some anxiety stuff that came up of like, man, like, why am I feeling anxious? Like, and I ended up, actually, this Dr. Guro, again, a beautiful human being. I ended up spending some time talking with her and talked through some things, I think the biggest fear of all of us, certainly myself, was failure. And so we had a lot of hard conversations, and talked through some things, and I came out on the other side better for it. And I'm not saying that I'm always perfect. Again, they bring me, different times or different seasons. I don't love change. So like end of medical school, residency, like leaving for Cincinnati for 3 months. Back in January was, it's never a fun time, that kind of stress that goes along with that. But I think that was pretty, looking back, like that's what she was saying, right? Even if you didn't know that this was something that you were, that you dealt with or had going on, it's a different type of stress when you enter into the healthcare field. And there's not a lot like it, even as amazing as, being, college athletics was physically demanding, but the mental demands of being a medical student was a different bear in and of itself.
One of my favorite sayings is always like getting comfortable with being uncomfortable. And I
Mm-hmm.
think that that's so true. There's so many changes in life. Like our life is so dynamic and we forget that and we get really comfortable wherever we are. But I do think that any kind of rigorous program like that is just going to totally take you to new heights. I feel like it takes up so much of your so much of your being that you like if
Mm-hmm.
you have a certain fuse, right? It takes up so much of your fuse that all those things that were taking up that space get pushed into this tiny little space. And so they have nowhere to go except out, right? Which is probably why they come up. Sometimes I think in
Exactly.
unexpected ways, but it sort of forces you to do some housekeeping in yourself, right? And
Yeah.
process some of those things. And I think ultimately ends up making you a little more clear-headed as far as what you want in life. And I think it's
Mm-hmm.
healthy to take that like note, and kind of do that housekeeping, like spring cleaning every so
Mhm.
often,
Mm-hmm.
every couple of years, and dive deep and figure out what do you want out of this and what's worth it to you? Where are your priorities? What are your values? Because I think those core values for most people don't change. And
Yeah.
so like when we live incongruently with them, they end up coming out in a way that's like anxiety or, depression or anything else that can
Mm-hmm.
affect your day-to-day life. So that's really cool advice from her. I think it would have also gone a little bit over my head. I would have been like, oh, that's cool,
Yeah.
and then when
Until
it
it
hits you
hits
in
you.
the face, yeah, you're like,
Yeah.
oh, this is what she meant. Got it.
Well, and
Yeah.
it's
You're
really,
like, I don't have anything big. Oh, go ahead.
oh,
Yeah.
sorry. No, you can finish.
No, I'd say like we're all like, oh, like, right. I don't have anything big,
Yeah.
Yeah.
under
Med school's big.
It doesn't have to be
So
big,
good.
right?
Yeah,
You said it perfectly, Annabelle. When you crunch that space down, it doesn't have to be big to get pushed out.
My patients that are in pain, I use that analogy with them, and that's what made me think of it because they're like, why am I so irritable? I'm like, well, because you have this fuse. And right now, this much of it, it's constantly annoying your brain with a pain signal. And now
Mhm.
this much of it is all that's left. And when your wife, husband, kid, dog, whatever comes up and is like, I need this, you're like, listen, dude, I've got this much left, right? That's it. That little bit. And that's all I got because pain is taking up the rest. And so
Oh,
that
the
just
Yeah.
world
changes
of
your
pain.
mood. And they're like, oh, and they're like, don't feel
Mhm.
crazy anymore. It's really cool.
Oh, absolutely. That's a great analogy. Absolutely.
I just wanted to mention that when you were talking about how you had some anxiety because you were afraid of failure, it's ironic because Annabelle and I just actually recorded an episode strictly about failure within the healthcare profession because, from the start of medical school, residency, fellowship, anything that you're doing throughout your training, it really is structured. On this day of this year, you take this test that gets you to this step to prepare you for the next
Mm-hmm.
step. And then all of a sudden you get in practice and it's not like that anymore. And you have to kind of recognize that there might be a day where you fail. Your surgery might go perfectly, but that patient
Mm-hmm.
doesn't get better. I might
Yep.
deliver the best treatment that day, but that patient comes back for their follow-up and their pain is worse.
Mhm.
Like we have to prepare ourselves for that because I feel like we just don't learn it in our training very well. So that really stuck out to me because you had everything going for you. I mean, school was going well, life was going well, you were fit, healthy, but still you had like this part of you that was kind of almost being attacked, if you will.
Mhm.
And it's just that little bit of fear of something like failure that can really do that. So
Oh, yeah.
I think you've done so incredibly well. And I've loved hearing your story. Seriously. It's been great.
Well, it's a constant. My father-in-law had a great idea this year of everyone picking a word to kind of define their 2021. I think after this past year, a lot of people do it all the time, but it was something new for our family.
Yeah.
And my word was content.
Mm.
I love
I
that.
think that I think it's hard. Like for me, like I'm someone I am type B in many ways. John could probably tell you this, Rebecca, but medical school has brought out the type A in me.
Mm-hmm.
And again, same in residency as it is in practice. There's always something you could be doing. But I think that it's being, I wanted to focus more on this year of like being content in the time to relax, be content that I can only do so much today, be content, that, I will have time to do this later. And what I need right now is to relax and watch a movie with my sons, a show with my wife. It's the contentment of just relaxing and being in the moment. that I think I really, wanted to focus on this year, because it's been something that, I think is something that is easy to do in the healthcare field. Is you can always find something to do, whether it's learning, whether it's charting, whether it's, there's always something you could be doing, but do you need to do that right now? And do you need to look at something else? And especially with these, that's where I said social media is amazing, but sometimes you're like, why am I even looking at my phone? I'm not content just sitting here for a minute.
Yeah.
I think 2020 brought that out. A lot of people, because of last year, have realized, you know what? I always joke, I think we did an episode on this, Annabelle, I think with the physiatrist, Dr. Jim. So 2020 almost took us back to the 90s, where we could just sit out on a porch with a loved one and just talk for hours. And before 2020, I feel like that was stripped from a lot of our lives. And now we're realizing, I kind of want some of that back. I want to be content with something ordinary.
Have you seen fashion right now? It definitely brought back the 90s. I don't know if you saw that or not.
Well, the 90s were the best decade ever. So
a little bit.
I wish every day that I was 25 in the 90s. I really missed out. Thank you so much for joining us too. I mean, anyone who's listening who's a student or thinking about becoming a medical student, I think can have some really great takeaways from this discussion tonight. So thank you for joining us, Ethan.
You're so welcome. It's been a pleasure to be on. Again, you guys are this is a super important part of healthcare, right? That it's the little things that we don't learn in medical school or whatever, healthcare field that you're in, that it's the things we don't learn that end up being some of the most important things when you get out into the world, or some of the most important things when you're struggling with, is this is this the right choice, or why is this so difficult? And I think that's it's like you said, it's a beautiful part of being in the healthcare field, is that you're making a difference, but that 2% sometimes weighs a lot, but there's nothing that I would rather do. I will say that wholeheartedly. I come home at the end of the day. It may have been a really long day in the OR today. We had 8 surgeries, but there was nothing I would rather do. It was extremely rewarding. I love it. It makes me honestly a better dad and husband when because of the job that I do. It gives me perspective about what's most important. And to see and interact with people of different backgrounds and ethnicities is something that I do not take for granted, and I think is a wonderful privilege.
I love it. Well, you're doing amazing things, so thank you so much.
Thank you.
Ethan is seriously such a gem, you guys. I hope this episode helped to teach you something that maybe you didn't already know about medical residency, and maybe helped motivate you to blast through your training with confidence if you are somebody that's currently deep in the trenches. The light at the end of the tunnel is a real thing, and even if you're out of training, this episode probably provided you with a little bit of healthy PTSD from your time back in school. I mean, how did we even cope with all of these things, with residency, being a student, having a normal social life? All of these things come into the picture. I know for me, my saving grace as a student was playing pickup volleyball. It just had to happen weekly, and it was the only way for me to really remove my brain from the constant learning and work environments that I was always surrounded by. We all just kind of need that release sometimes, so don't forget. Also, in today's episode, we briefly touched on a previous episode that was all about fearing failure, and this was in episode 22 with Michael Hildebrand, a physical therapist. So if you loved today's episode, definitely go back and check that one out. As healthcare providers, we have to recognize the challenges that often follow us after our training and learn how to overcome them. Have a great next 2 weeks.
Thank you for tuning in to the Provider's Report. We hope you found today's episode valuable and inspiring. To stay updated with our latest episodes, subscribe to our podcast wherever you like to listen. For more resources and continuing education opportunities, visit our website. Together, we can make a difference in the lives of our patients and truly set a standard for value-based healthcare.